Hi, I'm Breanne, and I'm currently pursuing my National Hand Therapy certification.
I'm Paige. I'm doing exactly the same.
And we are going to be presenting today on how to manage and relieve some of those carpal tunnel pain and symptoms. So before we get started, I know there's going to be a lot of questions. So there is a question and answer box somewhere on your screen. And at the end, we will kind of review those questions. Our lovely person on here from corporate, Kate, is going to be kind of filtering through those and letting us know what questions we have, so we're not repeating the same question. Some of the objectives we're going to be going over today is just gaining a basic understanding of the anatomy that's involved with that carpal tunnel syndrome. We're going to discuss some general facts. We're going to learn some treatment strategies and talk about our role as occupational therapists and how we can help you address those symptoms.
So the anatomy of the hand and the wrist, it's not that complex in this area. So you have 9 tendons and 1 nerve that pass through this little tunnel here. Okay, so that's the carpal tunnel right here. And that nerve, it's very sensitive. And so when we'll learn more about it, but when there's some compression on that nerve, that's when you get those sensations of numbness and tingling. But it's all about that nerve being squashed. And you can see right here that's that covering right here. So there's not much room. It's nice and packed. If there was more room, things wouldn't work as great as it is. So there is nice and packed movement going on in here.
So the nerve that we're talking about is your median nerve. You have 3 nerves that run through your hand. You have your ulnar nerve, which is in the green, and that controls and the sensory input to your small finger, so your pinky, and half of your ring finger. Only half of it. So that's where people often get confused. They're like, oh, my whole ring finger's numb. But usually it's one half or the other. So kind of pay attention to those symptoms. That median nerve is the one that controls the other half of that ring finger, your middle finger, your index finger, and your thumb. And then obviously the back of the hand, we kind of have a picture up there as well, where the radial nerve is more involved towards the back of the hand, but you also have your median and your ulnar nerve as well.
So what is carpal tunnel syndrome? So carpal tunnel syndrome, it's pretty common. It's accounted for 90% of all neuropathies. It occurs when that nerve that goes through that carpal tunnel, which we talked about previously, becomes pinched or compressed, and it causes those symptoms of that numbness. It usually radiates into the thumb, the index, the middle, and then that thumb side of that ring finger. And so it's letting you know that something mechanically wrong is going on in this area. And so it wants to be unsquashed. And so usually if you change your wrist positioning, the symptoms kind of go away.
So some factors leading to carpal tunnel syndrome, I know in general, we were just talking about, we see a lot of hairdressers, dental hygienists, people who are working in construction. It's that repetitive use of the wrist and the hand. When you're constantly doing that 8 to 10 hours a day, that can often lead to carpal tunnel syndrome. Another issue is vibrating tools. So whether it's a mixer that's vibrating with our cooks and our bakers, or a big heavy jackhammer with more of our men, that vibration is terrible for that nerve, puts a lot of stress on it. Obesity is another factor, autoimmune disorders such as rheumatoid arthritis, pregnancy, because you are your hormones have increased, a lot of inflammations in the body, the hands swell, the feet swell, and often with pregnancy we see carpal tunnel syndrome diminish immediately after the baby is born, if not a couple weeks after. You can still do things to prevent the carpal tunnel while you are carrying, though. And also inflammatory conditions such as cellulitis is often a factor.
So we've kind of talked about this already, but your signs and symptoms of carpal tunnel syndrome, some people do complain of pain, but their main complaint is the numbness and tingling. So the pain usually is occurring when it's been going on for sustained a long period of time in your life. And so normally we've talked about that distribution, but it's usually going through that thumb, index, middle, and then that thumb side of that ring finger. Sometimes people just have complaints in one finger when it's just early on, or it's just starting to becoming present. So it's not always all 4 fingers, but that is traditionally that pattern. Sometimes as it progresses, you'll have a decreased sensation in that hand, poor ability to use your hand with fine motor skills. So something is picking up like a paper clip or your earring, things like that have become difficult to do. You do develop hand weakness depending on the severity of your carpal tunnel. A lot of people describe having clumsiness, and again, that coincides with that fine motor skill deficit. And then as it becomes in that later stage, more in that severe stage, you start to see here that muscle atrophy. So it pretty much means that that muscle is dying and wasting away, and you lose all that strength in that.
So a couple things you can do at home to see if you may or may not have carpal tunnel syndrome is provocative positioning. So what we see on the screen right there is called Phelan's test. And you can put the backs of your hands together, your elbows go out to your side, and you give a pressure, but not so much pressure that you're causing pain, but some gentle pressure through the backs of the hands, and you hold it 60 seconds to 2 minutes. And if you notice numbness and tingling, that can often be a sign of carpal tunnel because you are squashing, as you can see in that picture, that median nerve. Another test that you can do is called reverse Phelan's, and that's when your hands are coming up like this in kind of that prayer pose and giving that nice deep pressure as well. If you go numb and tingly there, it's probably a sign of carpal tunnel, and you should contact your physician for further clinical correlation. We here sometimes can do sensory testing to see if you have feeling, and typically it's the tips of the finger that lose that sensation, and that's why you often drop things. So you might have the strength. We get people often with 10, 15 pounds of pinch strength, but because they can't feel at the tips of their fingers, they can't even tell if they're hanging on to a peg or an earring or a piece of food, different things like that. The only way to see that if you do have carpal tunnel syndrome with an objective measure is an EMG test. And that is where they put the needles into the nerve and see how long it takes for that input to get down to the hand. Obviously, that's something you have to go to your physician for, and that also shows how severe of carpal tunnel you have. So when we get your report, we know if you're mild, moderate, or severe, and what's kind of happening with your muscle and your senses by the time you come to us.
Yep. And I know with new technology is always changing. The EMG standard used to be needles, but I believe they're now trying to go into like electrodes. So if you're afraid of needles and all of that, I believe that there are some other clinicians that can perform them with an electrode. So that is, I believe, an option nowadays. So treatment options, some surgeons will do a corticosteroid injection to help with anti-inflammatory, to decrease that inflammation in that area. There's also anti-inflammatory medications that they can prescribe you to help decrease that inflammation and that swelling. Surgery is an option depending on the severity of your carpal tunnel. Occupational therapy and orthotics are all treatment options, and we'll talk about them going forward.
So some of the stuff that we do when you guys come to see us, we educate you. One, we really go into detail about the anatomy involved and how carpal tunnel has progressed specifically to you, because when you come, obviously some people are mild, some people are severe, and the treatment can vary greatly depending on how severe your carpal tunnel is. For the people who are still working with, especially now working at home on the computer as a remote worker, we talk about office ergonomics, how you're supposed to be positioned at the keyboard, how you're supposed to be positioned even in the office, in the chair. If you're crafting, we get a lot of crafters and sewers, knitters, those body mechanics. Talking about activity modifications. So a lot of people push through the numbness and they keep going, such as when they're building something or they're baking or doing just the things they like to do. If you are holding something and it's going numb, you are in a position where you are squashing that nerve, and you have to either one, modify the activity or take more frequent rest breaks until that numbness goes away. The nerve triumphs everything, and once you squash a nerve and damage it, you cause so much damage that sometimes you can't get it back. So one thing we do when you come in, we also talk about orthotic management, where we all know typically that you wear a brace at night for that carpal tunnel syndrome. They often sell them on the shelves at Meijer's, Walmart, Rite Aid, but they are one size fits everybody. So it might not necessarily fit the best to you, which we'll talk about a little later in our PowerPoint. The other thing we do is we give you some exercise to help with that muscle flattening that Paige was talking about earlier, with that muscle mass in the palm of your hand.
So for office ergonomics, we're going to talk about that. It's usually most of our complaints of people at the computer all day. That's, where people are getting their symptoms from. So simply put, it's the science of fitting the job to the people. And so we need to make things different and to accommodate ourselves to the workstation is what we're trying to usually do, but that's the wrong thing to do. We want to make sure that we change the whole workstation to accommodate for our needs. So that way we're not causing compression on our median nerve. So a lot of the times when it comes to using a mouse is we want to rest our wrist on the table, which again puts pressure on that nerve. And so with carpal tunnel, it's not always just a bent position or compression. It can also be from repetitive grasping. So as we grasp and we release and we squeeze things, we're increasing pressure in that area, and that pressure takes up room. And so that can compress your nerve as well. So a lot of the times when you see a therapist, we're going to ask you, what are you doing that causes you numbness? We want to figure out, is it positioning? Is it from vibration? Is it from sustained grasping patterns? Is it from repetitive grasping patterns? What's causing that numbness? And a lot of the times we ask you to come in with a photo of your workstation so we can see, are you at the right height? Are you floating your wrists? Are you putting pressure on them? So a lot of our treatment sessions is tailored all around what you guys need. And we give you tons of tools to fix your environment, and that usually helps get rid of your symptoms. We've had a lot of the times patients have not had to have surgery because we've helped them so much, and that's significant.
One thing I want to say about this workstation, because I just had one this morning, is she went out and bought a carpal tunnel guard for her keyboard, where it's that nice foam thick padding, but that's wrong because you are still resting those wrists on that foam padding. So just because it's cushiony now doesn't mean it's good, because you are still squashing that median nerve.
Mm-hmm.
So a lot of those off the shelf things like that might not necessarily be beneficial for you. It could be actually making your symptoms worse.
And as what Bree just demonstrated, as you have that bar, you're pressing that nerve, but then also it's making your wrist come into that extension. So you have two factors that could be squishing that nerve. So our best option is take that bar. You don't have to throw it away, but you can bring it farther down so your forearm is resting on it and the wrists are free floating. So you're still getting that support to your arm, but it's not directly on that very superficial area where that nerve it can get squashed. Anything else on this part?
No, there's so much you can go into with office ergonomics. So that's where it just gets really down to what your profession is. We've built up handles for hairdressers, built up handles for dental hygienists. We've done different things depending on what your occupation is to accommodate for you. And that's why therapy is so beneficial, because it's really specific to that person.
And right now, Bree and I kind of share this patient, and she kept going numb when she's crocheting. And so I had her bring in all of her tools, and I watched how her patterns. And so a lot of the times it's not just the compression, but it can also be that wrist extension with ulnar deviation, and ulnar deviation is going towards that small thing, or that pinky. And so how she crochets, she's going a repetitive extension and then ulnar deviation. And so that's influencing her symptoms. So I made her, we'll talk about it in a minute, but I made her something custom out of thermoplastic to help give her brain and the whole arm kind of some support to remind herself to prevent going into those positions. And so we'll reassess her when she comes back to see how much that helped. But standard, my past 4 patients, it's made a world of a difference for them. So those are all factors too. And depending on your pinching pattern, so if you have something that's small, you have to squeeze and hold it tighter. And so we usually will use these things called thermoplastic pellets. And so we put them in this warm water, we take them out, become gooey, we put them on your tool, and then we have you hold it, and we build up that custom pinch. So that way you're not holding it with such a sustained tight pinching pattern. It's lighter, which helps get pressure off of that nerve because we're not increasing the pressure in that area. Those are some little things we can do.
It's fun. We have a lot of fun. So next, which we talked about a little bit earlier, is that orthotic management. So it's specifically aimed to prevent that movement at the wrist. So at nighttime, just the way we were born, we all do it. We sleep like this. We all like to curl up, and oftentimes either your wrists are bent or you're sleeping on your hand, which is increasing the pressure in that carpal canal as well. So the best way to do it is we have depending on who you are, 6 to 8 hours for sleeping, depending how long you sleep, to take some pressure off that nerve. So the biggest thing is using some sort of prefabricated, or in the next slide, we'll talk about a custom fabricated option that we do. The problem with the prefabricated that we are running into is they don't fit everybody. So they are one size fits all. And most of the times they do not fit appropriately to our patients because we all have different anatomical hands. And some places are thicker, some people are smaller, some wrists are skinnier, some wrists are bigger. So it doesn't always fit that person. If you already have one of these, you can bring it to the session with you, and we try to modify it the best we can so that you're not spending more money on all these orthotics, or you might not need the custom orthotic, but we try to modify it the best we can. We put that metal bar in the appropriate wrist position. So with this carpal tunnel brace specifically, there's a metal piece that will run right along here. And so we can modify that if it's not appropriate. The other thing is, a lot of these that I see people bringing in include the thumb. So with carpal tunnel, you don't have to have the one that encapsulates that thumb to keep him straight. The thumb can actually remain free because what you're trying to position is that wrist into extension.
So we've talked about this, but we make custom orthotics. And so it is literally a sheet of plastic, and it's hard, but then sometimes we have to make a pattern to you, or we have pre-cut blanks, small, medium, large, but we cut in the excessive material we don't need off. But we take a sheet of plastic, we mold it to you after we get it warm. And so we're trying to get that appropriate wrist positioning. Sometimes we'll use a goniometer to help make sure that we have that correct angle. We build in that palm to make sure that it stays in position. So you'll see us, if you came and got one or get one, we are cupping you and helping build in that palm and that arch. So that way it doesn't slip around everywhere. It's nice and secure to you. And we make sure that your fingers here can still bend and they're free to move. And so it's really, this can be a great option for you because it's linked to greater success with symptom management, because it is custom tailored to you. So usually it doesn't fit somebody else. It's to your needs and your anatomy.
So going on to our exercise program. So some people have joined us again from our arthritis seminar. This is a very similar exercise. So it's called differential tendon glides. And these, if you ask any surgeon that we work with, our hand specialists that we talk to, it's so important for the hand because you have those 9 flexor tendons that are running up through that carpal canal. And these exercises make sure those tendons are gliding nicely back and forth past each other. They are just important for the hand as aerobic exercise is for the heart. So are you gonna pull it up? I don't know if
we can try. If not, we'll walk you through how to do them. And I believe that we can probably send this one sheet out to you guys if that's something that we can do. I'm not too sure, but let me just see open link. Oh, yep, it's gonna work for us. So we'll just start the panel. Yes. So in this, every therapist kind of does their tendon glides a little bit differently, but this is just the standard that we've always used and it works great. So the first position, you'll see it looks like this. So your main objective is that we want to get this 90 degree here, 0 and 0. And so you want to hold that position. It's not this. We don't want any limp. We want nice and straight, 90, 0, and 0. And so you're going to hold that for about 2 to 3 seconds. And then we're going to go into the next position, which is a fist. And so notice that I have a nice curve here. I'm fully into my fist. My fingertips are tucked in. I'm not doing this. I'm not this. I am nice and tucked in, and my thumb is crossed over. Okay. And you want to make sure that wrist stays nice and stable, not this and not this. It's just nice and neutral. We hold that for 2 to 3 seconds and we go into the next part, which is that straight fist or that flat fist. So the difference between the one you just did and this one is that now my fingertips are straight. And we hold that for a quick second. And now we move into the next one, which is that active hook fist or clawing. And you're here. And now watch, I'm dragging my fingers back. All right. And I'm not doing this, right? Because now I'm using something totally different. I'm doing this, so it's isolating those tendons. And so I want that backwards motion right here. So theoretically, you want to make sure that you pop them back so you could balance something on them. Okay. So this isn't full motion. We want that back. And we're very particular if you come and see us. And then you hold that and then we finish straight and wide. Okay, and it's not this, it's mean, nice and straight and wide. So we'll do them again. We do that 90, 0, and 0. We do a full fist. Then we move into our straight fist. We go into hook. And then we finish straight and wide. So that all is one rep. And we usually recommend doing about 5 of them 4 times a day. It's something that you should, even if you don't have carpal tunnel, it's something that you should always keep in the back of your mind because it's so essential for the hand and it helps decrease that stiffness and improve those gliding of the tendons. So it's not like gluey gumminess in those tendons that they can isolate from each other. So I tell my men all the time, this is like WD-40. So it makes the hand just move so much better.
So some of the other things you'll do when you come to therapy, so the differential tendon glides is the biggest one. It's usually the #1 exercise we give out. But then as time goes on, once we get you in that orthotic and we kind of see what your needs are, we really start to strengthen those muscles that are innervated by that median nerve. It's that muscle flattening that we talked about earlier that is super common. So just because we can't feel something doesn't mean we don't have that strength. So we want to build upon the strength we already have, and we often can use our visual cues to allow for that strengthening to happen, even though you might not be able to feel the putty or feel the different stuff we're doing. We're using that visual cueing to strengthen those hands. So part of that's that putty we just talked about, and then the intrinsic exercises, which we don't have it attached here, but if you were a part of our arthritis seminar, they are linked on that one. And when you come in, we'll give them to you. We increase the range of motion. Some people come in and their fingers just are not moving very well because of that numbness and tingling. So again, that will be tailored to you, whether it's your wrist that's not moving, your index finger, your thumb. We kind of go from there depending on what the needs of the patient are. And the last thing we often work on is that fine motor coordination, working on those smaller, more manipulative type things to increase that in-hand manipulation, your dexterity, different things with writing and being able to do the leisure activities such as the sewing, the knitting. For men, often it's using a screwdriver and nails, being able to pick up a screw, being able to pick up a bolt, things like that. So it's tailored for men and women both ways.
And so our last slide, it's more of a little bit of a joke. Our clinical director that has been training us and mentoring us, she likes to hunt and peck. And so it was a little joke for her. But if you have any of your symptoms, talk to your physician and get a referral to come and see us. And we can kind of help rule out maybe something else that's going on. Is it truly the compression of the median nerve, or is it coming from the ulnar side of the hand? We can kind of help figure out what's going on with you and help aid in your diagnosis. The main take home, I guess, bullet point from us is that if you have numbness, don't put it off and be like, it'll get better. You don't want to mess with the nerve. If it becomes entrapped for too long, that nerve can get damaged. And then sometimes even surgery doesn't fix it. And we've had patients in the past that have been it's been going on for 30 years. And they finally decide, let's get the surgery. And it doesn't fix them. But sometimes it does, and they're lucky. But if it doesn't, you're left with a burning sensation in your hand. You sometimes can be left with significant complaints of pain, the deficit with grip, motion. A lot of things are impaired. And so if you have any of these symptoms, just talk to your physician and get enrolled in occupational therapy, and we can see what we can do for you. But yeah, you just don't want to mess with that nerve. It takes precedence, like Bria said.
Nerve triumphs everything.
Mm-hmm. And these are our 16 locations. Occupational therapy specializing in the hand is offered in Saginaw at Bay Road. That's where Bree and I are located. But we do also have a hand therapist in Frankenmuth and a neuro occupational therapist in Bridgeport. And then there's a catch-all, generalized great OT in Carroll as well. But again, if you want treatment for your carpal tunnel, your best bet is to come see us at Bay Road or Frankenmuth. We would love to work with you. So now we'll leave it up to Kate to help filter through some questions. I'm sure people have some.
I've been watching. I haven't seen any come in, and I had a couple, but then you guys popped up and answered them for me. So great comprehensive information that you shared. So thank you guys. And just for everybody who registered today, you will receive a follow-up email that has a couple of like the top 3 takeaways from today. And then we'll just include that simple exercise sheet as well. So you can follow up with that later, as well as a link to watch the recording if you'd like to. Oh, I did just have one pop up. Somebody said they have the most tingling when they hold a cell phone. Is that more likely to be carpal tunnel, or might that be
When they
something
do
else?
what?
When they hold their cell phone?
It can be carpal tunnel. A lot of the times we do have patients that complain of numbness and tingling when they hold their cell phone. Again, it can be the positioning of the wrist. I guess the next question for us is going to be, where's the tingling? Is it certain fingers? But a lot of the times it can be that sustained grasping pattern. If you're holding it tightly, the best modification we can give you quickly is like on my phone. You don't really see me ever hold my phone. I have this is a Wally case. I don't know, they make all different kinds, but it has a loop in the back. And so I don't have to hold it now. My wrist can be neutral and I can still text. And so there's less likely to get kind of numbness. So I really love these and I recommend them.
That's great. I wish that probably is going to be a whole other webinar about how to use your phone and not get a bent pinky.
I'm always
or all those
complaining.
things.
If you come and see me, I treat you and I'm nice, but sometimes I like complain about my thumbs because the phones are just they're huge.
bad.
They're huge.
They're bad.
And they're destroying our CMC joints and our thumbs. We can help you with that too.
Great. Well, thank you, ladies. I really appreciate it. You guys did a wonderful, wonderful job. So thanks for sharing
Thank
this with us
you.
today.
Yeah, I hope to see some of you guys in our sessions. So thank you.
Oh, she said, what was the name of that case again? Sorry, one more.
Oh,
question.
it's called a Wally. I believe it's WALLIE, but it also has like a pocket in the back for like your debit card or your license too.
They also have the loopy case.
Yeah,
I think it's
I've
talking
had
about the
these in
loopy.
the past, and I love the loopies, but if you get sunscreen on them, it breaks down their coating.
Oh.
So I've abandoned loopy and I've moved on to Wally, and I do really like it, but it can also be a kickstand too. Mine's really worn out. I've been using it, but it will stay like this, and you can hold your phone up and it props it up for you. So there's a lot of beneficial things.
Oh, wait, we're starting to get questions come in. Do
Oh,
you
good.
have a couple more minutes?
Yeah.
Somebody said, I was diagnosed with the beginning of carpal tunnel in my right hand, but it doesn't always bother me. Should I still seek treatment?
Yes.
Yes, because we can help it from right now. It sounds like you're probably in the mild stage. If it doesn't bother you all the time, there's still patterns that you're doing that's influencing your symptoms. So coming to see us early on is the number one thing you can do, is learn everything that we can teach you on how to modify things. We can look at your activities that you're doing, help you with recommendations, just like the one person just did. I'm not sure if it's the same person, but something as simple as, holding my phone, I go numb sometimes, or reading in my bed, I go numb sometimes. And so we have all of these resources that we can help you with. So yes, I definitely think it's beneficial. And I don't know if Breanne mentioned this, but when you see an occupational therapist, especially Breanne and I or Christine, sometimes you're only with us 4 sessions. It just depends. I've treated somebody that had severe carpal tunnel, and it was mostly when she was working. She did cleaning. She cleaned a hospital, I believe, and she went numb in both hands, and it was severe, moderate to severe carpal tunnel syndrome. And I made her these little wrist stays. I know I said I'd talk about it, but I forgot. So I make them out of plastic. They're small. They're not as big as those wrist cock-ups that you saw in the photo. But it goes like this. It goes down to a little bit past that wrist, and it helps remind that brain and that wrist to stay in that healthy position. And so she used them on both of her hands, and she could sweep, she could do everything, and she didn't have her symptoms. So something as simple as that we can help you with. So definitely think it's worth seeking treatment early on, so that way you don't get to that moderate to severe stage, because once you get into that moderate and therapy doesn't work, that's usually when they say maybe we should do surgery. So if you're in the mild right now, you're in a good position to see a therapist.
Also, with being mild, I would highly recommend getting in a brace or a splint or orthotic. We kind of use that word interchangeably as soon as possible, just because over time it can develop into moderate or severe. And that's one of the best ways to prevent, one, needing surgery, two, any further damage that can be caused is by getting into one of those things at nighttime to prevent that further compression of that nerve.
Awesome. I think the questions are answered. So unless I see any
Beautiful.
pop up, but wonderful. So basically just the earlier you intervene, the less treatment you probably need is what.
Yes, there's research that supports early intervention with an occupational therapist can prevent further compression and need for surgery. So it's definitely worth it.
One of the questions we do get often from patients too, briefly, is they come in and they say my whole hand's numb, and we really try to differentiate whether it's the thumb or the small finger pinky side. And there is something called cubital tunnel syndrome, which could be affecting that small finger going numb. And we can also help address that by coming to see it. It's similar to carpal tunnel, but it's happening either near the elbow typically. So that's something else we can talk about.
And another thing that we assess, if you come in and you haven't had an EMG done and you say, both of my hands are numb, and it is my thumb, my index, my middle, and maybe the thumb side of that ring finger, but it's both of my hands. And so we're going to sit down and say, let's get a physical therapist in here quickly and have them screen your neck, because our nerves come from somewhere, right? They come from our spinal cord. And so if there's compression going on in the neck, it can radiate your symptoms. So we can help figure out if it's truly carpal tunnel or if it's something else. And a lot of the times, if you're wearing your wrist braces, you're doing what we say, but you're not getting better, and it's both hands, then we'll say, let's look more into that neck situation and, talk to your physician and see if they can do more with the neck, because that could be where your symptoms are coming from. So there's a lot of things that we can do to help get you in the right pathway too.
And that's great too, because we have physical therapists on site at both of our locations where we offer hand therapy. So that's nice that we can kind of collaborate that way.
Yes.
I did just have somebody ask if we need a doctor's order for this. Do you want to talk on that a little bit?
Yep. So I know with physical therapy, if you have your private insurance, you do not, from my understanding. If you have Medicare, Medicaid, you do. But occupational therapy and physical therapy, we both have our own organizations. And unfortunately, for occupational therapy, we do not have direct access. So yes, we do need a referral from your physician. But yeah, usually they're willing to sign them, and it's usually not any hassle.
And for carpal tunnel specifically, you probably just need it from your primary care doctor. That's not something where you generally need to see a specialist. Is that right?
Yep, you can talk to your primary care physician. And if we think that, there's more going on, we can help you get you in the direction of seeing a specialist. There's a handful that we work with that we can kind of talk to you about, maybe getting a consult with them if we feel like it's necessary. So talking to your primary care physician is sufficient.
Awesome. I think we've had a couple false alarms, but I think that might really be the last question. So thanks again.
That's okay.
Yeah, everybody who's registered, look out for that follow-up email. That'll probably go out before the end of the day with the recording, and also some nice links and tips for you as well. So thanks again, ladies. We appreciate you so much.
Thank you. Thanks, everyone.